very difficult to become healthy, wealthy, and wise if you're having trouble getting out of bed due to back pain. So I'm going to show you 3 exercises you can do before you even get out of bed in the morning. I'm a physical therapist, was trained at the world famous Mayo Clinic, worked there for a while, so I know what I'm doing. Let's start off with number 1. Wake up in the morning. This is one we have a lot of patients do, even when they're in the throes of heavy back pain. So most of you should be able to do this. All you do is you lay on your back. You can do these on the floor, by the way, too, if you'd like. You lay on your back, you bring your knees up, both of them, and you're going to gently roll your knees back and forth like this. Now, as time goes on, and if this feels okay, I want to re-emphasize or emphasize that all exercises should be painless. I don't want to increase pain. In fact, what I'd like to see is that it actually decreases the pain or feels good. But as you go on, if you want to try to stretch a little more or bring the legs over further, you can. The further you bring your legs up like this, the higher up in your back the stretch will go. Now some people go to this length where they'll actually bring the leg over the edge like this. Meanwhile, they're keeping their opposite shoulder down on the bed. This puts a great torque on the back, a great stretch. It's good for the mid-back, but again, no pain. That's exercise number 1. Exercise number 2. This is based on the McKenzie method. Robin McKenzie, his method has become famous worldwide, used in over 34 countries, and it's based on a model of where they're trying to shrink your pain. So if you start to feel the pain spread out when you're doing this exercise, that's a bad sign. What you'd like to see is that it's shrinking and maybe even going into the center of your back. That's called centralization. That's what you want to see. What you're going to start off with, for most people, I'd actually take a pillow and put it underneath their hips to start off with this exercise. Just like this. You're going to get up on your elbows first and let your back acclimate to this position. Then after a bit, if that feels okay and there's no increased pain, maybe reduced pain, then you're going to go ahead and put your hands underneath your shoulders like you're going to do a push-up, but you're going to keep your pelvis down. And then you're going to press up a little bit like this. It's going to start warming your back up, getting movement in the back. Movement is always good. Joints love movement. Then after a while, if that feels okay and the back again is not, the pain is not spreading out, or if you're not having any pain, that's fine. Then you can go ahead and push all the way up. Eventually, if that becomes too easy or it doesn't give you trouble, you can even take the pillow out and do it like this. I do these every morning, and I actually do them in the evening too. A very good preventative back exercise. All right, the next one. Again, I emphasize no pain with all of these. In this one, you're going to actually get up on all fours. You're going to put your knees about as far apart as you can. And you're going to have your hands in front of you, and you're going to lean back like this and stretch. Now, if this hurts, what I want you to first try is to actually arch your back up and then lean back. If that hurts, then I want you to arch your back the other way. We call it kind of cat camel. Arch your back down like you're going to have a, like a camel hump, I guess. So then you lean back and go back this way. Now if that still hurts, if it hurts on, let's say, this side, the next thing I want you to try is bring this leg up further toward the hand. And I want you to go straight back in. I don't want you to go off to the side. I want you to go straight back and again stretch it. I actually want you kind of putting your hands out like this. Stretching your hands way out in front of you. Okay, that goes for the beginning point too. You want your hands way out in front of you. Stretch way down like this. If that pain still isn't any better with putting the knee forward, you can even try putting a pillow underneath that side. Hands way forward and then try it again. If you continue to have pain despite all those alternatives, then that exercise just is not for you. Try these 3 exercises, and this will help you get out of bed in the morning, and hopefully you can start the day with a pain-free back and go on and pursue becoming healthy, wealthy, and wise. Thanks.